Hello everyone. I will be going over Chapter 1 from the Green Book, An Approach to Patient Education. Alright, first I will go over the learning objectives that you will be learning about throughout this chapter and give a brief overview of what each objective will be about. The first one will be the importance of education. Patient education is a key component of effective healthcare management. Understanding how to educate patients helps them take responsibility for their own health, make informed decisions, and adhere to treatment plans. This awareness improves health outcomes and strengthens the relationship between patient and provider. The next one will be communication techniques. Effective communication is essential for educating and motivating patients. Next will be demographics and chronic illness. Patient education must consider individual differences such as age, gender, education level, and cultural background. It also varies depending on the chronicity of the disease. For example, long-term conditions like diabetes require ongoing adaptive education, while acute conditions may need focused short-term teaching. Next will be cultural perceptions of illness. Patients interpret illness through their cultural norms and personal beliefs. Some may see illness as a spiritual imbalance, others as purely biological. Understanding these perceptions help healthcare providers adapt education methods so that information is respectful, relevant, and effective. And the last objective will be education for diverse populations. Health professionals must be able to adjust their teaching strategies for different patient populations, children, elderly individuals, those with disabilities, or patients from different ethnic or socioeconomic backgrounds. Using culturally competent and inclusive approaches ensures that education is accessible to all. Next, we will be going over the main points of the chapter. The first point will be encourage patient participation. This means that providers should motivate patients to take an active role in their own healthcare. Moving on to the next point, promote healthy behavior change. This means whether through medication adherence or lifestyle changes, providers must communicate and motivate effectively. Moving on, address emotional responses. This means to recognize and manage patients' emotional reactions to diagnosis or treatment since these affect outcomes. Next point, recognize importance of patient education. This means to acknowledge patient education as a vital component of effective healthcare delivery. And our last point, integrate education into healthcare advancement. This means to treat education as equally important as clinical and technological progress within the health system. All right, let's get into it. The first thing we'll be going over is a model for patient education. Recognizing the importance of patient education is the first and most essential step. After this, healthcare providers must learn and apply effective communication and interview techniques to educate and motivate patients to become active participants in their own healthcare, rather than remaining passive recipients. Using a checklist can be a valuable tool in guiding the interview process, helping the provider organize both the content and the flow of the interaction. Now here's an example of a checklist that you can use to interview one of your patients. This checklist illustrates different elements, and this model can be adapted to suit any disease or health concern that needs to be reviewed with a patient. The following section offers a brief discussion of each checklist element, serving as a helpful refresher for conducting patient interviews. Now that we've seen the checklist, we're going to go over some key things you can do to open up the interview with your patient. When starting a patient interview, it's important to create a comfortable and friendly atmosphere. You can begin with small talk or short, casual remarks to break the ice, such as asking if they had trouble finding the office or commenting on the weather. These simple interactions help set a relaxed tone and encourage open communication between you and your patient. A friendly smile and pleasant attitude makes a big difference. They show warmth and help the patient feel more at ease compared to a cold or rushed approach. Using good eye contact and maintaining a professional demeanor are also essential. This means being attentive, respectful, and organized throughout the conversation. It's also helpful to outline what the interview or session will include. Just like a teacher gives students an overview before a lesson, you can give a patient's sense of what to expect. For example, you might say, "Today I'd like to explain your diagnosis, go over our findings, and discuss the treatment plan we've created for you." This clear structure helps the patient feel informed and involved in the process. Now, after you have successfully opened up the interview to your patient, now it's time to discuss the disease. So when transitioning into the main part of the interview, you can smoothly begin by saying something like, Now let's talk about your results. This gives you an opportunity to discuss lab work, x-rays, or other tests in simple, clear language so the patient fully understands what the findings mean. Once you summarize the lab and physical results, you can move on to the diagnosis. You might say, for example, after reviewing your test exams, we found that you have a condition called blah blah. At this point, it's helpful to ask, what do you already know about the condition? This question helps uncover any misinformation or assumptions the patient might have, especially if they've heard things from others or online. It's equally important to explore how the patient feels about the diagnosis. Ask questions like, how do you feel about learning this, or what are your main concerns? Understanding their emotions allow you to offer reassurance and build trust. This emotional support helps the patient engage more fully in their care and treatment plan. Next, take time to clearly explain the condition or pathophysiology in simple terms. Avoid medical jargon and use analogies or visuals when needed. Providing both verbal and visual explanations can make the information easier to understand. Always check that the patient truly grasps what you've said by asking them to restate it in their own words or by briefly summarizing the key points together. Now, after explaining the condition to your patient, the next step is to review the treatment plan that has been designed for the patient. A smooth way to transition is by saying something like, now let's talk about how we're going to manage this condition. It's helpful to start with the overall goals, for example, reducing symptoms, improving function, or maintaining a healthy lifestyle. Then explain the specific steps in the plan, such as medication, exercise, or lifestyle changes. It's useful to tell the patient how many steps are involved, maybe 3 or 4, so they have a clear roadmap of what to expect. Providing handouts, visuals, or diagrams can help reinforce understanding while asking questions along the way, keeps the discussion interactive between you and your patient. If the treatment involves a medication, it's important to clearly explain how to use it, possible side effects, and any precautions, such as avoiding certain foods or other drugs. Giving patients written instructions or package inserts they can take home helps reinforce key information and improves adherence. Because following a treatment plan often requires major lifestyle adjustments, healthcare providers should assess how ready the patient is to make those changes. It's important to ask supportive questions like, which part of this plan seems easiest for you to start with, or what challenges do you think you might face? This helps identify barriers and builds confidence with the patient. Finally, before ending the session, always check for final understanding. You can do this by asking, can you repeat the treatment steps we discussed? This ensures the patient fully understands the plan and feels prepared to move forward successfully. After covering both the condition and the treatment plan, it's important to check the patient's overall understanding. Ask open-ended questions like, do you have any questions about your condition or the treatment plan we discussed? This gives the patient a chance to clarify anything they're unsure about and helps you gauge how well they've understood the information. Next, explore how the patient feels about the diagnosis and treatment process. You might ask, now that we've talked about your condition and the next steps, how are you feeling about everything? This helps identify any fears or doubts they may have, especially if they're worried about being able to follow through with the plan. At this point, showing empathy and reassurance is key when talking to your patient. Patients feel overwhelmed or uncertain, so offering supportive statements like, I know this is a lot to take in, but I'm here to help you through it, can make a big difference. This sort of encouragement helps build trust and confidence between you and your patient. And be sure to provide helpful handouts or resources the patient can review or share with family members to reinforce understanding. Finally, schedule a follow-up visit and confirm that the patient can attend. This ensures continuity of care and provides an opportunity to revisit progress or address new questions. So now that you know how to summarize and close up the interview between you and the patient, let's go over some appropriate use of interviewing techniques. We're just going to go down the line and list off each of these bullet points. These are a lot of the techniques that you'll be using in patient interviews to help strengthen the interview. So first one's going to be try to clarify patient statements, reassurance and empathy, appropriate use of silence, appropriate vocabulary, use of open-ended questions, facilitative behavior, use of notes, use of educational aids, flexible in presentation, good transitions, appropriate pacing, good use of summaries, professional in appearance and demeanor, appropriate use of nonverbal language, appropriate use of patient's background, makes clear the next step for the patient, asks for questions, closure, and follow-up. These techniques are the foundation of an effective patient interview. It's essential to use clear, appropriate language so the patient fully understands both their condition and the treatment plan. Encourage patients to share their thoughts and feelings by using facilitation, good eye contact, pauses or silence when needed, and a mix of open-ended and direct questions. A successful interview also requires flexibility. It's important to balance giving information with showing reassurance and empathy. Smooth transitions and a steady pace help make the conversation easier for the patient to follow and absorb. Finally, using visual aids, diagrams, or handouts can help it reinforce key points and ensure that the patient leaves with a full understanding of their condition and what steps need to be taken next. Now we will go over the specific suggestions for enhancing the patient education process. The following suggestions that we're going to go over will aid in enhancing the patient education process. So the first specific suggestion that will be used to enhance the patient education process is going to be to pay attention to using good interviewing techniques. Helping a patient manage their medical problems means knowing how to both educate and motivate them to make positive changes. This takes strong interpersonal and communication skills. It's important to pay attention to both what the patient says and how they express themselves non-verbally. Over time, you learn when it's best to simply listen and when to step in with information or support. Being prepared and organized, such as reviewing lab results, creating handouts, or developing a specific treatment plan, helps make the entire process smoother and improves the patient's understanding and compliance. So now, the next suggestion we will be going over is to present information through several channels. When communicating with patients, we shouldn't rely only on verbal explanations. Some people learn better through visual aids like charts, handouts, or x-rays. Visual learning can often make complex information easier to understand and remember. In addition, peer support can be a powerful motivator. Patients who connect with others going through similar experiences, whether in person or online, often feel more supported and are more likely to follow their treatment plans. Next, we're going to be going over teaching with supplemented materials. The patient education process can sometimes feel overwhelming because there's often a lot of information to cover. To help with this, it's a good idea to give patients written or visual materials they can review later, such as brochures, handouts, medication guides, online resources, or even an outline of their treatment plan. Providing these tools help patients reinforce what was discussed during their visit and improves their overall understanding. Now, the next suggestion that we'll be going over is to involve family and significant other. It's important to remember that patients are part of a larger family system. Family members are often deeply concerned about their loved one's health, and involving them in the care process can be extremely helpful. Their participation can even improve the patient's ability to follow the treatment plan. Encourage patients to share information about their condition with their family, and invite family members to join follow-up appointments. This allows everyone to better understand the situation and learn how they can provide support. Next is to be sure to raise the sensitive issues. Some topics in healthcare can be very sensitive, and patients might have fears or concerns they don't feel comfortable sharing. Subjects like sexuality or end-of-life issues often fall into this category. Because these topics can cause embarrassment or sadness, patients may hesitate to bring them up. It's important for healthcare professionals to initiate these conversations when they relate to the treatment plan. For example, discussing how a medication might affect sexual function or explaining that a treatment may only provide comfort care. Addressing these subjects shows patients that it's safe to talk about difficult matters and helps them express their real worries and emotions. Next is to be attuned to emotional reactions. Patients often experience strong emotional reactions when they learn about an illness or begin treatment. To provide truly comprehensive care, healthcare professionals need to explore and address these emotions, whether it's fear, anger, anxiety, or depression. If these feelings are ignored, it can negatively affect treatment outcomes. Encouraging patients to express their emotions and offering support is a key part of the patient education process. Next, don't think that when the topic is covered, it is completely resolved for the patient. For some patients, simply providing education about their disease or treatment plan is enough to motivate them to follow through with the care. However, others may still have questions or feel uncertain even after the initial discussion. In these cases, it's important to revisit those concerns at a later appointment. Some parts of a treatment plan, like making lifestyle changes, such as quitting smoking or losing weight, can be especially challenging and may require ongoing encouragement. Reviewing the treatment plan during follow-up visits, celebrating progress, and identifying areas that need more attention can help patients stay motivated and engaged in their care. And the last suggestion to enhancing the patient education process is to be okay to saying "I don't know" to the patient. It's common for healthcare professionals to be asked questions they don't immediately know the answer to. Instead of guessing or using confusing technical terms, it's best to be honest and simply say "I don't know." Admitting this shows professionalism and honesty. You can also follow up by saying "I'm not sure, but I'll look into it and I'll get back to you." This kind of approach builds trust and shows the patient that you're committed to giving them accurate information. Now we're going to go over other factors influencing patient education. Health is a complex concept that involves more than just treating disease. In the United States, healthcare often focuses on curing acute illnesses using an infectious disease model. However, many modern health problems are not caused by a single germ, but by multiple factors, such as behavior, lifestyle, and environment. People's reactions to illness are also influenced by their culture, personal experiences, and how serious they believe the illness to be. Understanding these different perspectives helps healthcare professionals provide more effective and compassionate care. Now we'll start with the patient's age. When it comes to patient education, age is one of the most important factors to consider, yet it's often overlooked during counseling sessions. Every stage of life brings unique physical, emotional, and cognitive differences that affect how a person understands health information. The range of care begins with infants and extends all the way to the elderly, and the approach should be adapted for each group. Let's start with children. They are not simply smaller versions of adults. Their needs, thought process, and emotional responses are completely different. Small children often view hospitalization as something negative, even as a punishment, rather than as a way to get better. This misunderstanding can be made worse when patients use fear-based statements such as, "If you go outside without shoes, you'll get sick and have to see the doctor." These kinds of comments can create unnecessary anxiety and cause children to develop fear or mistrust towards healthcare providers. It's important for clinicians to use calm, positive communication and to include reassurance during interactions. Infants, while too young to understand words, respond well to touch, facial expressions, and soothing tones, which help build comfort and trust. As children grow into adolescence, healthcare professionals must keep in mind their changing language, attitudes, and social environments. Teenagers often see themselves as independent and knowledgeable, which can make them resistant to advice or instruction. In many cases, they may also feel pressured by their peers, so guidance about healthy behaviors like disease prevention or lifestyle choices needs to be delivered in a way that fits their social reality. Rather than lecturing, it's more effective to engage teens in open discussions that respect their opinions and encourage them to take responsibility for their own health. Now, moving into adulthood, the educational approach needs to shift again. Young adults, generally between 20 and 40 years old, are often balancing many priorities, such as college, careers, and family responsibilities. They may not have much time to focus on their health, so education should be practical, concise, and directly relevant to their daily lives. Adults in their 40s to 60s tend to be more health conscious, especially as they begin to notice age-related changes or chronic conditions. They are often motivated to learn about prevention and management, but some may struggle with self-confidence when learning new health information or skills. Healthcare providers should create a supportive environment that helps them feel capable and encourages questions without judgment. For older adults and the elderly, the educational focus should include empathy and patience. Individuals over 65 may have rich life experiences, but can also face barriers such as sensory loss, slower processing, or skepticism toward new methods. Some elderly patients might feel that learning new information isn't worth the effort, especially if they believe their life is nearing its end. In these situations, healthcare providers should recognize their past experiences using respectful communication and find ways to connect the new information to what the patient already knows. Encouragement and understanding can go a long way in helping elderly patients stay engaged in their own care. Overall, recognizing and adapting to the differences across age groups is crucial for effective patient education. By adjusting communication styles, providing age-appropriate materials, and showing empathy, healthcare professionals can help ensure that patients of all ages truly understand their care and feel motivated to take part in improving their health. Now that we know how to educate our patients based on their age, now we'll talk about ethnicity. Ethnicity refers to a person's sense of belonging to a particular cultural or social group, which is often defined by shared language, ancestry, religion, traditions, or physical traits. In the United States, there is a wide range of ethnic diversity, including groups such as African American, Asian, Caucasian, Hispanic, and Native American. In fact, there are more than 100 distinct ethnic groups and over 170 Native American groups across the country. Ethnic groups should not automatically be confused with minority groups, although there is often overlap. For example, African Americans are both an ethnic group and a minority group. The concept of ethnicity is complex and can be difficult to define because it involves not only cultural identity, but also how society perceives and interacts with different groups. For healthcare professionals, understanding the ethnic background of each patient is extremely important. Cultural values, language differences, and beliefs about health and illness all play a role in how patients understand and respond to medical information. If these factors are not recognized, communication barriers can easily occur. A good example is found in public health programs such as HIV prevention initiatives, which have sometimes failed to reach certain communities effectively. In some African American populations, cultural attitudes, traditions, and gender roles have influenced how information about HIV is received and understood. When clinicians take time to understand and respect these cultural perspectives, they can adapt to their communication, build stronger trust, and ultimately improve the effectiveness of patient education and care. Next, we'll talk about family. When it comes to patient education, it's not just about focusing on the individual patient. The family also plays a crucial role. How a family functions can greatly affect each member's health and how they respond to illness. Including family members and significant others in education sessions help improve understanding, confidence, and adherence to the treatment plan. Healthcare professionals should make use of the family's strengths and support system. For example, when teaching a patient with diabetes how to give insulin injections, involving family members in the process can increase success and make the patient feel more supported. Family members can also help identify problems or step in when the patient struggles with complex tasks. However, not every patient has access to family or close support. This lack of assistance can make managing care more difficult and can lead to poor outcomes, especially for patients with conditions like HIV who may experience social isolation. These patients often deal with complicated treatment regimens and need extra encouragement and follow-up. To improve care, healthcare professionals should stay in regular contact with both patients and their families. Checking in on progress, providing guidance, and addressing new issues early can make a significant difference in treatment success. Next, we're going to talk about socioeconomic status. When providing patient education, it's important to consider a person's socioeconomic status, since it can strongly affect how they can access and respond to healthcare. Individuals in lower socioeconomic groups are often less likely to seek medical help early, and when they do, it's usually later in the course of their illness. Unfortunately, this can lead to a poorer outcome and even shorter life expectancy compared to those in higher income levels. Clinicians should take time to understand each patient's situation, including their income, living conditions, and employment status, to better tailor care and education to their patient. Studies have shown that lower socioeconomic status is closely linked to higher rates of chronic diseases such as coronary artery disease. While healthcare providers can't eliminate poverty or fully solve access issues, they can still make a positive difference by connecting patients to community resources, offering guidance on affordable care options, and promoting healthy lifestyle habits. Clinicians can help improve health outcomes. It's also important to recognize that some patients may not know what services are available, so part of our responsibility is to guide and support them in finding the help they need. Moving on from socioeconomic status, we're going to go talk about the chronicity of disease. When working with patients, it's important to recognize that acute and chronic illnesses affect people differently. Acute illnesses tend to come on suddenly and may cause temporary distress, while chronic illness often bring long-term emotional and physical challenges. As healthcare providers, we need to be aware of conditions that may require additional emotional support or even psychiatric care during the education process. It's not enough to simply tell a patient about their diagnosis. Patients need time to process the information and adjust emotionally before they can focus on learning about treatment or lifestyle changes. Their reaction will often depend on how serious or life-altering the illness is perceived to be. For example, a patient diagnosed with acute pharyngitis might feel miserable but knows it's a short-term condition that will heal with proper care. This patient may not need much counseling. In contrast, someone diagnosed with end-stage congestive heart failure faces a serious, often fatal prognosis and may experience feelings of fear, sadness, or hopelessness. In these cases, additional support from a psychiatrist, social worker, or nurse may be needed to help them cope emotionally and mentally. Understanding these emotional differences allow healthcare professionals to tailor patient education and provide compassionate, individualized care. And in conclusion, the model and suggestions discussed in this chapter are designed to help guide the patient education interview process and serve as a helpful refresher for healthcare providers. While this isn't the only approach that can be used, it offers a comprehensive framework that covers both the process and the content of effective patient communication. And that's it for the video. I hope this video helped you guys. Thank you all for watching. At the end will be my references.